Small intestine 15 is located 2 cm lateral to the inferior border of C7. Locate your C7, use the medial border of the spine of scapula to dictate your 3 cm mark, move out 2 cm to find this point.
Stomach 15 is in the second intercostal space, 4 cm lateral from the midline. Stomach 20 is 2 cm lateral to the midline, 5 cm superior to the centre of the umbilicus at the level of Ren 13. Ren 5 is on the lower abdomen on the midline, 3 cm superior to symphysis pubis.
Lung 9 is located on the lateral aspect of the wrist flexure, in between the radius, the scaphoid, which is one of the carpal bones, the radial artery, and the tendon of abductor pollicis longus, which is this big tendon that can pull the thumb out. So find the dip between all those 3 landmarks and the radial artery and mark your point there. Lung 6 is located 7 cm proximal on a line from lung 9 to lung 5. Lung 5 is located on the transverse cubital crease in a depression which is just radial to the aponeurosis of biceps brachii. This point has a nice, soft, swampy feel to it. Be careful to not go too radial and to fall onto the tendon of brachioradialis.
Lung 3 is 3 cm inferior to the anterior axillary crease, in between the lateral borders of biceps brachii and the shaft of the humerus. In relation to large intestine 14, it's slightly anterior and inferior to it.
Gallbladder 44 is the lateral nail point of the 4th toe. Be sure to mark this point clear of the nail bed and try and tuck it into the flare of the base of the distal phalange. Gallbladder 42 is located on the dorsum of the foot in a depression proximal to the junction of the heads of the 4th and the 5th metatarsals. If you articulate the metatarsals, you can easily palpate the groove in between the 2 bones. This point should be located medial to the tendon of extensor digitorum longus, little toe branch. To show this branch of the tendon, pull the little toe out. It's normally quite visible. Gallbladder 43 is located half a cm proximal to the web margin between the 4th and fifth metatarsals. Try and tuck this point neatly into the flare of the base of the proximal phalange of the fourth toe.